Welcome to New York City Health and Hospital Kings County YouTube podcast. I'm Dr. Melissa Lee, Director of the Lifestyle Medicine Program. We are taking over this season's podcast to really focus on the launch of our Lifestyle Medicine Program. In this episode, I am pleased to welcome Sarah Patel. Sarah is our health coach working with the Lifestyle Medicine Program, and we'll be meeting with our patients not only individually, but also weekly in group sessions throughout their 6-month journeys through lifestyle medicine. Thanks so much for joining us today, Sarah.
Hi, Dr. Lee. Thank you for having me today and having me aboard as well in Lifestyle Medicine Program.
Well, Sarah's here to talk about one of the key pillars of lifestyle medicine, and that's stress. Not that anyone has too much stress, has too little stress. I think we all have some level of stress, and kind of thinking about how we manage this and how we integrate that into part of our daily lives. So let's just get right into it. Can you tell me a little bit about how you define stress and how this impacts our brains and our bodies?
Yes, stress is something that we all go through, and stress is a normal reaction that happens to all of us. And it's one of the body's method to reach the challenging and demand that we ask in a sudden matter or sudden way. And stress can be either physical, emotional, psychological, or environmental. When the stress happens, our brain and body produces two hormones, which is adrenaline and cortisol. And that's when we experience something called the flight and fright responses, and we react to it in a sudden way.
I love how you mentioned stress as really a normal response, because I think often we talk about stress and there are these negative connotations, but really it sounds like it was developed for our survival. And as such, it's something that we need to use for our benefit and know how to manage. So tell me, when you're working with patients in our lifestyle medicine program, what are the things that you do to teach folks about managing their stress?
Yes, that's awesome, because in lifestyle medicine program, we kind of take through the patients to recognizing the stress first, as we've mentioned before, and differentiating between an acute and chronic stress, because there are two types of stress that happens. And also how does the acute stress becomes a chronic stress in the time and as it goes. And how do we manage the chronic stress, which is everyone that goes through, such as eating patterns, ways to manage the stress through plant-based food, exercising, sleep, meditation, and also creating a toolbox for the stress management. That's what I do with patients. I help patients with that. And basically, those are the things that we will be working on in Lifestyle Medicine Program.
It's great that you describe this as a program that gives people a toolkit. Because as you're describing, it's at different points in your life. You may have acute stressors, you may have chronic stressors, and you may need to pull out different tools, whether it's meditation, exercise, changing the way that you're eating so that it can make you feel good. I think that that's a great way to really frame some of the work that you're doing longitudinally with these patients. What are some simple lifestyle changes people can make to reduce stress that they already have, or maybe to prepare for situations that they feel might be stressful in the future?
So this is something that we go through every day in life, even maybe in a traffic jam, or maybe running late because there's a traffic. And one of the biggest things that we all don't relate is uninterrupted sleep. And also exercising. We all talk about exercising, but how does this exercise actually help us to release stress in a very short time? Sometimes we are in the middle of something, but we want to help to reduce and regulate our body. At the same time, also practicing meditation and breathing techniques. It can really help us to soothe. And there are way much more tools that I'll be discussing.
You remind me of some programs that we started at Kings County, like our Thursday Walk to Wellness, and really challenging folks, patients, and staff to take a break and stand up from the desk. The work is always going to be there.
Yes.
And to take a few minutes to have some conversation, build those relationships. That's so important for lifestyle medicine as well. And to really use physical activity as a way of relieving stress.
Definitely. That's awesome.
So what techniques do you like to teach in the classroom when you're talking about managing stress and regulating one's brain and body?
Great question, Dr. Lee. So there are many types of techniques that we can use. And I go through quite a bit during the classes. We have meditation and movement classes during the lifestyle program. But today I'm going to introduce two simple exercises that anyone can use during the day just to comfort themselves, whether in stress or non-stress, or even like buying a coffee, just being mindful about your breath and how your body is and giving the relaxation to your brain and body during the whole day. So are we ready to start something short?
Yes.
Let's
bring it on.
All right. So you just breathe in through your nose and let it all out through your mouth just for 1 to 2 minutes. So you could do walking, you could be in the bathroom, you could be just on the phone waiting for the music to be over. Just take a deep breath through your nose and let it all through your mouth. And if you feel really stressed out, you could take and hold your breath for maybe 5 seconds and let it go. Do remember to let it go because we need to breathe. And you can also have your eyes open or closed. So that way, we can just keep going, breathing, and slowly we can take it calm and slowly and let it go and happen as a normal breath.
Thank you so much for sharing that simple breathing technique with us, Sarah. I love that you can do it eyes open, eyes closed. You could be on a subway. You could be in an exam room. You could be anywhere you want without any special tools. And I think it can be really helpful. You have such a good voice for this too. I think this is what makes you such a great coach.
Thank you.
All right. And you said that you had another example as well.
Yes, this one, it's called the squeeze and release exercise. So what happens is you could be in any place, take a deep breath through your nose and let it out through your nose instead of your mouth. And then just with 1, 2, 3, squeeze all the muscles that you have in your body and just let it go after. And again, take a deep breath through your nose and let it out through your mouth. So what happens here is you're indirectly increasing the blood flow as well as you're making your body to deviate from your stress towards your muscle action. So whereby your brain turns the stress into a deviation and takes the anger or some frustration through the squeeze of the muscles. The only note point is if your muscle hurts, please let it go earlier than that, because sometimes people just hold on to it and forget to let it go. So that is the key point. But it's a very quick deviation towards stress release at any place. And just keep breathing and continuing the simple breathing method, which deviates and gives good supply of oxygen to your brain, whereby your stress just deviates and moves away.
Okay, so this is something that dissipates stress. And just so I understand, so you're breathing the whole time. And on that first 3 count, then that's when you're tensing your muscles. And on the next 3 count, that's when you're teaching yourself to relax.
Yes.
And let everything melt away.
Exactly.
That's really beautiful.
Yes.
Well, thank you so much, Sarah. I think that we have some news you can use from this podcast. And I hope that listeners will be able to try this out and see how it moderates their mind-body relationship with stress.
Thank you so much for having me. And hopefully everyone will be stress-free moving forward.
Sounds like a great idea.